right. Thank you very much. This is our 2024 interview with our Advisor of the Year, Dr. James Wasco, representing Public Universities Advising. I really appreciate this time to really get a chance to talk conversationally with you, Dr. Wasco. And just as I said, for the next hour or so, or maybe a little less than an hour, I really have been looking forward to this conversation with you. So thank you so much for joining us.
Well, I'm actually delighted to be here too. I am just enthralled with and very happy to be involved with medical school advising and health career advising after a long career in medical care. So the opportunity to talk about it really makes me very happy.
Well, again, we appreciate it too. So I know I don't know exactly how to have you shorten or give us an abbreviated view of your career, but however you wish to describe it, tell us about yourself and your journey to become a physician, at least, and highlight any influences, mentors, whoever has kind of shaped your career.
Okay, well, thank you very much. May I call you Emil?
Yes, that's fine.
Okay, and feel free to call me Jim as well. So I grew up in Grand Rapids, Michigan, in the west part of the state, and went to undergraduate and medical school at the University of Michigan. I did a first year of residency in Chicago at what is now Rush Medical Center, then went in the Air Force for a couple of years as a medical practitioner, and then came back and did additional training at the Brigham, it was called Peterbilt Brigham, now Brigham and Women's Hospital, and became interested in emergency medicine and practiced emergency medicine in the Boston area. First of all, at a community hospital north of Boston, a community called Lynn, and then eventually the last 25 years of my career at a teaching hospital called the Leahy Hospital and Medical Center, affiliated now with the UMass Medical School. So I've always been interested in working with the University of Michigan because I essentially got my start there. And so became a volunteer doing many things and wound up with the board of the medical center and being president of the board nationally. And that was 21 or 22 years ago. And when I stepped down from being board president, I was looking for some way to stay involved in the medical school. And the dean at that time said, what about joining our admissions committee? We're always looking for alumni who are interested in the university and interested in working with students, and you do that in your practice. So we'd love to have you on the board. So I joined the admissions committee 21 years ago and have been a steady member of the admissions committee now every year since. And my role in the admissions committee of the medical school is during this time of the year between 1st of July and around mid-October. I'm one of the reviewers of the applications, and we get lots of applications, so we have quite a few people who are involved in that. And then starting in September, my role changes to be that of an interviewer, and so I'm involved with what's called long-form interviewing, which is 35 minutes of one-on-one interviews of selected candidates, and we do that during the application cycle of interviews from September 1 to around February 1st. About 10 years ago, I got interested in particular groups of people, groups of candidates and applicants for the medical school. And I was involved in a committee with the University of Michigan Athletic Department. The athletic director at that time mentioned that out of our 950 student athletes, we always have 60 or 70 who are interested in going into medicine. So we'd love to have you involved. And so we started a program called The Doctor is In. And when I'm in Ann Arbor, we have an office in the athletic department where we meet with student athletes. We identify the ones who are pre-med, and we work with them during their 4 or 5 years in the athletic department, helping them with research opportunities, shadowing opportunities, clinical opportunities, and then with the application process itself, and just familiarizing themselves with the whole field of healthcare today. And although we also work with people who are going into physician assistant programs, therapy programs, nursing, dentistry, the large share of our applicants from that department come through for medical school. And so over this period of time, we've worked with close to 300 student athletes, and we have a pretty good admission rate there. And we just really enjoy the process. And so the opportunity for me to work with people along their journey to medical school just is invigorating and inspiring. And I look forward to every candidate that we meet. When I'm in Ann Arbor, we do it one-on-one. But when I'm not in Ann Arbor or traveling, or even sometimes when I'm there, we do our work on virtual means like we're doing here today.
Mm-hmm. That's
Don't have
fantastic.
very much more.
Exactly. So it's sort of long form interview, just like what we're doing here. So,
Exactly.
tell me a little bit more about how these students self-identify in terms of becoming physicians and how they ultimately connect with, especially the athletes over at University of Michigan. I'm sure, how do they, they're very involved with athletics. So I'm sure the athletics department is very, very involved in things that they're doing. So how do they connect with you?
We also invite members of the Michigan band and the dance team and the cheer team, as part of our group of students that we work with. Many of the students come in knowing that they want to be pre-med. Even the student athletes, you think, well, maybe pro athletics is in their goal. And for some of them, that's certainly true, the high-end student athletes. But, I'd say 90% of the student athletes who come into a big university do not wind up having careers in the pros. And so they need to prepare themselves for careers that will be invigorating and encouraging to them once they finish with their undergraduate and or graduate years. But so some of them come in knowing they want to be pre-med. But when the academic year starts, we send a notice around to all of the student athletes who are in our catchment group, and we tell them about the program that we have and say, if you are interested in healthcare, you want to find out about the program, want to see if it might be applicable for you and interesting for you, then please get in touch with us. And that's how we find out about it. So we have at any one time, dozens of student athletes that we work with, but it's not only me and an ex-dean, a previous dean, a dean emeritus of the medical school also winds up doing interviews with me of the student athletes. And we have a couple of other physicians involved in it too. But one of the serious adventures, if you will, that we've gone through in this process started 2 years ago when we said, we've got a group of medical students here in Ann Arbor. Many of them have been student athletes during their academic undergraduate years. I wonder if they might help out being mentors. And so we then sent a letter to all of the medical students asking them to identify us if they've been undergraduate athletes before, and if they're interested in working with our current student athletes interested in healthcare. And believe it or not, we had over 65 former student athletes, current medical students appear. And so now when a student athlete appears in our program, when a student athlete appears in our program, we hook them up with a mentor who's with them as well as the counseling that we give to them in the office. And that's turned out to be very valuable because, now they're being counseled and mentored by people who are very close to them in age, who've gone through the journey not that long before them. And so they can give them great tips for, how to best navigate this journey, which is quite complicated and very challenging now, particularly with the numbers of people applying for medical school.
Wow, that sounds fantastic. And I'm guessing not that you're ever on the recruiting trail to high schools, the high school students and their parents. Is this something that's also discovered when they're recruiting candidates or athletes to be part of your school, to come to Michigan, obviously? So
yeah, that's a really good question. And the answer is yes, we do get involved in recruiting. And so when I'm in the office, the university athletic department has recruiting days. And so the coaches know to find out, the students with whom they meet, if they're interested in healthcare, interested in pre-med. And if they are, and they're still in high school, still being recruited, we will meet with that prospective student athlete and their families and their mother and father and maybe other people who have come with them. And we explain the program and explain to them that this is a rather unique program around the field of undergraduate athletics. And it's a program that they are eligible for because they are in that program.
Wow, that's really good. So one of the things that obviously athletics is a very strong gateway for individuals of various socioeconomic status. And obviously we could go in a lot more detail about some of the range that we see for family income. From whether it's your perspective or the perspective of your peers in the athletics program, what sort of additional concerns or what sort of additional points should be made, especially if you're talking to a student and their family who is from certainly a lower socioeconomic status and may not have had as much of the rigorous math science sort of background or the influence of family members in healthcare, especially in the doctoral levels.
Well, we have a group of academic advisors too in the department, and we make sure that they meet with the academic advisors so they learn, how to access the pre-medical programs, what kinds of courses they should be interested in, what kind of activities they should be interested in, and of course, the program in the athletic department that we run is free for them. So there are no, charges that they get. So it's part of their scholarship or part of their program just for having been an athlete there. But we do go through the issues with access to care that are so important around the country, particularly in the urban areas and the rural areas where location of healthcare resources may be difficult to get to. And we also talk about the issues of communication being very important, that with the number of people who have been immigrants well, first of all, we're a country of immigrants going back, to the beginning of this country. And over all the years that we've been a country, we have welcomed people from all over the world into the United States to be part of the United States and its programs. But in the last few years, we've had a dramatic increase in immigration, and many of them are Hispanic, from Hispanic areas. And so, we make sure that they are aware of this. And when they do shadowing opportunities and volunteerism and the things that we help them with, that we help them to explore the barriers of care that people around the country have getting into medicine. And one of them, of course, then is language. Another one is socioeconomic factors. Another one might be transportation. And another one, might be, if I can use the term, health illiteracy, particularly when it comes to preventive medicine. So they don't really know or haven't been educated in their countries for what it takes to be healthy, how to stay healthy, how to do preventive measures to keep you from being exposed to communicable illnesses and other community risk factors. And so we make them aware of all of that and let them know that, regardless of the background that they have coming from their families, whether they come from wealthy families or they come from middle-class families or they come from families who have struggled to make a living in this country, that they are all equal in our eyes, and we will do everything to help them get the same experiences that other people do in undergraduate school, so that when they apply to medical school, they are on an even footing.
Sounds absolutely fantastic. Do you, from your perspective, what are some of the challenges that some of the students are having with regards to their these other extracurricular activities that they really need to have, the community service, shadowing, and certainly other clinical experiences?
Right. Well, everyone's journey to medical school is different. And everyone knows that getting into medical school requires an exploration, not only of healthcare and your academic major or minors too, but also things that you're interested in, because you want to be a well-balanced person, when you apply to medical school. And so with student athletes, they have a somewhat unique problem in the sense that as part of their program, they have anywhere between 25 and 30 or more hours a week that have to be devoted to their athletics. Now that's team meetings, it's competition, it's practices, it's going to the gym and developing your physical capabilities. So that limits, along with the the STEM programs that most people are interested in if they're interested in medicine. And it interferes with some of the activities like volunteerism, like shadowing, and like research. As a result, the majority of our student athletes do not apply for medical school in their junior year so that they can wind up starting medical school in the same year that they graduated. Medical school application is a 15-month process, basically, starting the 1st of May. And then you're applying for the class that will start around the 1st of August in the following year. And so if they want to start medical school right after undergraduate school, they have to start that process in their junior year. But because of the requirements of time and energy, they don't get a chance to fulfill all the requirements for supplemental activities. And so many of them take 1 gap year, 2 gap years, sometimes even 3 gap years, so that they can give serious time to explore healthcare prerequisites, shadowing, clinical experiences. And shadowing, of course, can be active or passive, and we can talk about that. The more active you're involved in shadowing, the better you are. And also getting to know what the healthcare field is like and the issues that communities face trying to provide equitable care for all of the residents of the community. That means understanding things like disadvantages of homelessness, of poor food legitimacy, all the things, crowded conditions, all the things that we know are a problem, not only in the inner cities, but in rural areas too, where people are struggling to make a living. But even if they're struggling, they need to get good health care. And part of our profession in healthcare is to make sure that we do all we can to provide equitable care and overcome some of the barriers that we talked about before. And, medical schools will help you with that, of course, but it's wonderful if we can get the prospective applicants used to that before they even get to medical school, so that it becomes something that they know they're going to be exposed to, something that they know they want to be involved in. And so the result is, we look at applications. What do we look at? We look at the academics. We look at the academics of STEM fields and non-STEM fields. We also look at supplemental activities like research. How much have you done? What have you? You can get into medical school without research, but if you do, you learn some additional things which are helpful for your career goals. Then we want to make sure they have exposure to clinical medicine, either in shadowing, or we encourage them to become maybe an emergency medical technician or a certified nursing assistant, or work in a doctor's office as a medical assistant. Whatever opportunity you have to have contact with patients. We used to talk about shadowing as a proficiency that's important, or as an activity. But there are different kinds of shadowing too. I mean, there's one way of just sitting in the doctor's office and listening to the doctor-patient interaction, which is sort of passive. But we encourage now people to find active ways of being involved clinically so that they have a chance to talk with patients. You and I talked earlier that medicine is 2 fields. It's a science field and a communications field. And the more you learn about how to talk with patients, how to converse with them, how to deal with their anxieties, how to deal with sometimes their hostility, help them understand what questions they need to ask of the healthcare practitioner, and how to understand some of the complicated language. So the more they're exposed to that, the more valuable their journey is, I would say. And then lastly, volunteerism. And volunteerism, of course, is what we talked about earlier.
So obviously being in a very unique, well, for many people, they think it's very unique in terms of being able to screen applications as well as interview candidates. Yep. We may go into some of the nuances, whether you interview the people that you screen or they keep that separate. but I do want to get a sense from your vantage point about what makes an applicant competitive, and especially at a place like Michigan, you've got so many fantastic students, especially by the time you get to interview round. So, what are some of the things that impress you about an applicant that you feel this person can do it?
Well, first of all, I think it's important to know for anyone who is interested in their journey to medical school that it's highly competitive. And that means the numbers of people applying are significant. Around the country, in the 168 institutions providing MD degrees and the 60 some that provide osteopathic or DO degrees, it's not uncommon to have medical schools receive thousands of applications for each year. At our school, we approach and sometimes exceed 10,000 applications. And the number of people in each starting class at our school is around 170. You can't get into medical school anywhere without an interview. And no medical school can interview 10,000 or 5,000 or whatever number of candidates. And so every medical school has a number that they shoot for of applicants that they feel they want to interview, and they pay close attention to that. So how do we get from, at our school, it's in the 400s. So how do we get from 10,000 applicants to the 400 and some that we interview? And that's a complicated process, which requires multiple evaluations, multiple looks at the applications and the written application. The application itself for medical school is a one application system. So all the medical schools that you apply to get the same application. So it's not institution specific. It's rather intended to let medical schools know why you feel you want to be a doctor. As a philosophy professor told me one time, and I love this expression, you know that you're heading for a field that satisfies your concept of yourself. And your experiences help you to understand that. And so when we look at an application, what do we look for? Well, first of all, we look for grades. It's important medical school is trying academically, and we're going to make sure that you can handle the science load and that you're a sufficient student to be able to deal with the certifying examinations that occur in medical school and beyond so that you qualify for a medical license. So the academics are important. And secondly, the medical college admission test results. The medical college admission test is a very long, almost 7 hours, sometimes a little over 7 hour testing process, which is divided into categories. And it's the biologic basis of human illness, the chemical or physical basis of medical illness, the psychological or emotional basis of human illness, and then critical thinking. And so your scores on these four elements will indicate to many medical schools your proficiency with the sciences and with scientific investigation or critical thinking. So there's that. And then references are important. So medical students in applications are encouraged to have anywhere between 3 and 6 references from people that they've come in contact with, professors, leaders of clubs, coaches, people who have worked with them, research mentors, principal investigators, people who know them and work with them more than just sitting in a class, but know their background and what they're up to. So those references are important. And then there's a few essays that the application requires. The first is called a personal statement, and it's a 5,300 character, essentially self-portrait, which tells the examiners who you are, what your background is, what your proficiencies are, and what in the world made you want to go to medicine and why you think you're a good candidate and you need to be a physician to satisfy your ideas about your future career. So we look for passion in the personal statement. Then in addition to the personal statement, the applications also give you the opportunity to talk about up to 15 activities that you've been involved in that you think were vital in terms of helping you to mature, change your perspective, make you more interested in healthcare, provide scientific or clinical investigation. And so with each of those up to 15 items, they give you 700 characters to write just a brief, cogent statement of why you did this, what you got out of it, and what it might mean for you going forward. But 700 characters is somewhat limiting, 4 or 5 sentences, depending on how verbose you are. But the medical school application process will say, look, think about all your activities and try to select up to 3 that you think are most meaningful in your journey. And if you select those 3, we will give you an additional 1,300 characters to write about, plus the 700 normally. And that's an additional 13 for each of the 3. And so this gives you the opportunity now to say, well, I did research with this particular professor on a genetic basis as I'm on oncology or whatever. Here's what my process was. Here's what I learned in terms of the dynamics of research, what clinical investigation means, what kinds of research I can be involved in as a physician, either bench type or research that happens in a translational means when you get into your practice. And you learn about all that very valuable part of medical advancing. And so there we sit with all of these, all of these essays, all of these numbers. You have to list every academic course you've taken in every academic institution you've been to and the grade you got in it, and provide transcripts for the American Medical College admission system so that they can check and make sure everything's okay. So that's what we look for then, is a balanced list of activities. We look for passion in your personal statement and in your list of activities. And then we also, look for the types of activities that you've had. How much volunteerism, how much shadowing, how much research. And people will often say to me, how many hours do I need for each of these things? Well, since everyone's journey is different, the numbers vary. If you're a student athlete or a musician and you have 25 or 30 hours of extra time, you can put down that sport or that music or that painting or that poetry or whatever as a side interest. And that can be part of your interest. But because of all that, you may not have the same research hours that someone who is more interested in research. You may not have the same number of volunteer hours. So it's also the case that volunteer hours can be very productive or not productive depending on your commitment to it. So some people will say to me, I've got 10 different volunteer activities. And I look at it and there's 15 hours in each one. Well, how much did you really learn about the importance of that volunteer activity if you only were there for 15 hours? On the other hand, if you had 2 volunteer activities with 50 hours each or 100 hours each or even more, then it stands to reason that you're going to be more deeply involved. And so those are all the things that we look at, all the various prospects and all. And then when it comes down to choosing the people to interview, this is done by the executive committees of the medical schools. And it's a small group of people very experienced in medical school education, led by the assistant or associate dean of medical admissions. And they select the candidates that they feel will be most interested in our university, most productive at the university, and can bring a set of proficiencies that might be very, very helpful within the university itself, because you're going to learn and you're going to give, like every other educational field. When you went through your PhD, you brought, certain proficiencies to the PhD program, and you took many proficiencies away from it. And that's exactly what's going to happen in medical school too.
So in terms of, as I said, so obviously you're not in the discussion with the executive committee,
No.
But in terms of the people that you wind up seeing on interview day, and you're going to have your 30 or so minute interview. First of all, how many candidates do you interview per interview day? Is it 2 or 3? I don't know how it was.
I interview 4.
You interview 4. Wow.
Yeah, and that's typically the case with our interview day is very structured. Um, and some of the interviews are what are called long form interviews. And they are basically conversational encounters with a person like me to just discuss things on your application. So it's my goal before I see these interview candidates to review the application and review it thoroughly so that I know it well. And I can discuss their interests, on an educated basis with them. And actually doing it on a virtual basis makes it somewhat easier than doing it in person. I used to love doing it in person, but you always wonder, am I going to forget some things? And you take crib notes in with you sometimes, but you try to avoid it because you want to have eye contact, So this way I can put a little crib sheet on my computer and I can continue to look at people. So in order to prepare for the interview, I get a copy of their application and read it thoroughly. But in our school, we are blinded as an interviewer to certain elements of that application. We're blinded to the MCAT score, the Medical College Admission Test score. We're blinded to the GPA, and we're blinded to the references. And the reason is that our dean feels that all of us go into these interview days with a certain set of biases that we've developed over time. We all have biases, all of us, no matter who you are. Sometimes those biases can be a little bit helpful, but sometimes they can be unhelpful or even injurious when it comes to effectively evaluating a client. And as the dean said, I want you're the only persons, these interviewers are the only people in the application process that see personally the candidate. The rest of it's done by reviewing the paperwork. And so what we want to find out is, what are they like in person? What is their conversational style? How engaging are they? How many questions did they ask? What was their level of interest? Things that you gauge and get out of a conversation. So the kind of people that encounter these student athletes on our interview day are several. Two of them in our school are long form interviewers. Okay. But then there are an additional group of people that do what are called multiple mini interviews. And these are targeted 10-minute interviews over a particular point. Now, maybe it's a supplemental activity point. Maybe it's a point of interest. Maybe it's, why did you get interested in medicine? But a typical one might be, when you think about your past journey to medical school, tell me about something that didn't go as planned. Maybe something you failed at, or maybe something that your expectations weren't met. So explain what that was to me, how you dealt with it, what the outcome was, and what does this all mean going forward? And so in this 10-minute period, that's your subject with the interviewer. And it won't be 10 full minutes. It'll probably be somewhere around 6 or 7 minutes, because the first minute of the 10, will be a presentation on the computer of, here's the subject we're going to talk about. And you have that minute or two to think about it, to make notes of how you want to present it and all that. And then when you go into the multiple mini interview, they will say, do you understand it? If you don't, they will explain it to you. If you do understand it, then they'll ask you to start talking. And then it has to end 2 or 3 minutes before the 10 minutes is up, so that the interviewer can make notes.
Just before we get to the long form ones, for the MMI style interviews, is it like partly based on hypothetical scenarios, or is it mostly focused on like the application, what the applicant's, life and past life experiences has been, if you happen to know about the prompts?
Yeah, the prompts are generally prompts that will be given to everyone and won't be specific to an individual candidate.
Okay. Because
the 10-minute interviewer does not have access to your record.
Right. Okay.
And your application. So the 10-minute interviewer only knows you by what your name is, and that's it.
That's interesting. Okay, so you do an open file, but your closed file, your MMI is kind of a closed file,
Yes,
rapid
right.
fire, random
Yeah.
question, whatever. That's interesting.
Now,
So yeah,
now there are some medical schools that use only multiple mini interviewers.
yes,
The McMaster University in Canada, I think, came up with this process many years ago, and they feel that a structured system of multiple interviews will answer lots of questions, in many ways better, they feel, than some long form interviews, because the questions and the prompts are structured
right,
in order to give information that the school is particularly looking for. Now, some of them are one on one, but some of them are one on two. You might have another candidate in with you. So it's an interviewer and two interviewees, and they'll have you discuss a particular topic. And you discuss it back and forth. What is your opinion? What is my opinion? And we look for how closely you can interact with each other and how appreciative you are of the other person's viewpoint. And sometimes you uncover some things you don't want to see, you know.
Well, as they say, you can't totally prepare for everything you get on an MMI. So I appreciate that.
Well, no, and people will say to me, "What do you think my question is going to be?" In another school's interviewer, and I said, go on the internet, look up multiple mini interview topics, and you'll find 1,000 or more topics,
Right.
and you have no idea going into the medical school what that topic is going to be. But you do know that it's going to be not intelligent, not intending to be challenging to you or put you on an uneven keel with anyone else, but just to try to sort out what the medical school is looking for in terms of your goals, your passions, your activities, and essentially, why do you want to be a doctor and why do you want to be it here? Because a lot of the applications are going to be asking you that question. Why did you apply to this medical school? And of course, the one part of the application we haven't talked about yet is what's called the secondary application. So every medical school knows that when they receive your application, it is not institution specific, as I mentioned before. It is all about you, what your proficiencies are, why you think you want to be a physician, your passions and your activities that are relevant to this. But the medical schools have other questions. One might be, why would you want to come to this school? And it might be specific. What element of the curriculum did you find most interesting? Knowing that our medical school is very interested in diversity and equity and inclusion, what diversity do you bring to the medical school? And we treat diversity in a very wide, broad field, not necessarily skin color or language or gender, but what about you makes you a solid candidate? Think about yourself, and what are you proud of the most? That kind of thing.
So let me get you back to the long form interviews, because if you're interviewing 4 people every day, I definitely commend you. What are some of the things that for you make a successful conversation, especially given you have so many, and how how to keep everybody separated when you have to do your final summations?
Yeah. Well, first of all, we don't do it every day. We have the interview days once a week. And so, we have a week essentially to prepare for the interview of 4 candidates. So we look for, of course, conversational style. We look for nervousness, and we try to allay that nervousness as best we can. I mean, it's understandable there's going to be some nervousness. This is what you're talking about, going into a career that you've worked hard for, all these prerequisite courses and all these pre-journal years. And now you're sitting in front of one person and you're trying to make your case. So it's going to be nervous. But we try to say, listen, we just want to be conversational with you. We want you to tell me as much as you can about yourself, and why you feel this is important to you, and bring up some of the things you've done. And we'll ask you certain questions, but you feel free to ask us questions too. So we're looking for that conversational style. I'm looking for the passion, as I mentioned before. And you can tell when somebody is sort of rote about everything they say to you, they have memorized everything coming in there. And I want to try to get away from that and have you talk sort of off the cuff as best you can, so that we get a real internal feeling about who you are and what you're up to. And so, basically we are sitting with a person who we know is going to be a physician, or we hope is going to be a physician, and they hope. And so we want to make sure that the way they present themselves will be good for patients. Patients will appreciate them. They will understand the patient. It's sort of what we call cultural humility. And that's to be able to understand, who people are. When I meet a patient, for example, I want to make sure that that patient has confidence in me, and that I'm interested in them as an individual and their support systems. And so I want to make sure that whatever biases I have, I try to identify them, put them on the side, so that when I meet somebody one-on-one, I get to meet them where they live, so to speak. Who are they? What are their goals? What are their interests? What is their support systems? What has been the effect of this illness or injury that they have on their lifestyle? And if I'm going to be treating you or ordering diagnostic tests, am I going to interfere with your life in some way? And how can we form a team between you and I, so that I get the information I need, you get the information you need, and we get the testing that we need in order to make the right diagnosis? So, what that amounts to is a conversation, and one that is trying to get at the basic of the people we're looking at. That's sort of the same process we use in the long form interview.
Sure.
We try to adopt our cultural humility aspect and try to find out, who they. One of the questions I'm always interested in, one of the first questions I ask, is tell me something you're curious about.
Mm-hmm.
And before you're worried, it doesn't have to be medicine. I'm just interested in general what you're curious about. And we get phenomenal answers that really open up, I think, the conversational element to people, because now, well, I'm really interested in language, or I'm really interested in what makes people who they are. I'm interested in, how they choose their physician. Some will talk about curiosity in healthcare too, and that's fine. Whatever they pick, that's what we'll go with.
Sure. And now there are a lot of applicants that get a little bit anxious regarding any sort of conversational interview, and I'm not sure whether you do this, but certainly other people will ask the question about inconsistencies in their academic preparation, or things that they feel are weaknesses in their preparation to get into medical school. I don't know what your experiences have been about that.
Well, I think it's a very legitimate question to ask, and we have a list of questions that, I want to ask people. Some of it is just basic questions that I would ask anybody, but some of it also refers to elements that I have found in their particular application that I would like to hear more about. So if somebody, let's take research, for example, if somebody, writes very scholarly sort of answers about their research, going into extraordinary details about this gene or that gene, or what kind of process they used in the laboratory to help evaluate certain blood tests, and I want to find out how much they know about what this research means to them, and what it might mean with positive or negative results. I may ask a person who's been involved in research, tell me specifically about a dead end that you went down in research, where you had a proposal, you developed your techniques for how to evaluate that proposal, and then it turned out you didn't get what you thought you were going to get. What are you going to do about that? And we're looking for people to say, well, blind alleys can be just as valuable as alleys that work. We learn information, and we know that we don't need to go down that way. We need to focus on something else now. So, we learn positive and negatives. I frequently will ask somebody, what do you think is going to be the hardest part of going into medical school for you? Based on what you've done, based on your experiences, what's going to be the hardest? And that's fascinating too. Some people will say, focusing on something that I I haven't focused on for a long time, or how do I accumulate the opportunity to how do I accumulate all of this material without getting it confused to me? How do I learn how to learn when it comes to medicine? And understandable. We're happy to talk about that. But I will also ask people the opposite. Tell me about some problems that you might have had, or something that concerned you that you're still working on. I don't want to use the word failure necessarily, but tell me one of your biggest challenges and how you're solving that challenge. Because none of us is perfect. We all have to work on something, and we want them to feel comfortable that they can discuss challenges that they've had. And because what does that tell us? It talks about your resilience. It talks about your adaptability. It talks about your flexibility. And another word I love is grit.
Mhm.
It helps me to understand all that part of them. And so, those are legitimate questions, I think.
Sure. And with that answer, that kind of ties into what I know I'm interested in hearing from you is, especially knowing, well, if we go back to the athletes and, people that you've met through the athletics department, people who've had to take gap years for sure, they may have like a world of experiences, especially since they graduated, or they may have had a different career. Obviously, if they came back from the pros, for example, because that has happened. How do you help somebody, or how do you help someone who has that much more post baccalaureate type experiences, in real life, especially how would you extract such a good conversation in about 30 minutes with somebody like that?
Well, this is also an excellent question, because when we look at the average age of people who are matriculating to medical school, it stuns a lot of people to find out that it's close to age 25 in many schools. And why is that? Well, for some people, they started off academically in another career. Maybe they went into engineering, or maybe they went into finance or economics, or maybe they went into languages or some other, some other field that they thought was going to be interesting. Maybe they wanted to be a teacher. And then they got into the field and found out that it wasn't giving them the intellectual and the emotional stimulation that they wanted. And then when they think about what can I do now, they think, well, gee, maybe, just maybe healthcare is right for me. So then they've had to go and take a post-baccalaureate program to introduce themselves to the hard sciences. They've had to really work hard getting exposure to volunteerism, to shadowing opportunities, and to research if they want. So we treat every person that comes in as a unique individual, and we help them understand what benefits what you have already done will be toward your medical career, and what things you need to add on to it now to make you a more balanced applicant. Um, and, so you spent 4 years or 5 years in finance. Hey, this might be very valuable for you once you get into medicine, because the affordability of healthcare in this country is a major challenge. And you may have some tricks and techniques in your system that you've learned that you can share with other medical student colleagues. And who knows, you may wind up going through medical school to get, an MBA besides, medicine. At our school and at many schools, a substantial portion of people who graduate from our medical school graduate with another degree that they got while they were in medical school. So maybe it's Master of Public Health, maybe Master of Public Policy, maybe Master of Business Administration, or maybe Master of engineering, of one kind or another. So, everyone has a talent that they're coming in, and we don't need them to change everything that they've done, but to get the benefits out of what you've done, and how to put those benefits, how to put that knowledge into the new knowledge that you'll be learning.
I have to pin a different question that I know I want to ask before we end, but I did want to cover a little bit of the basis that we had discussed prior to this interview, And that is obviously this is a fantastic model on how the athletics program really is invested in terms of the career development and the well-being of their students, especially in getting to health professions, careers, and so forth. So I want to make sure we could talk a little bit about how the scope of this program has expanded since you started, and also a little bit about your advocacy to try to have other, this as a model program for other universities and institutions to support athletes and those, other people associated with athletics departments in other universities.
Yeah, well, we have talked with the medical director of the NCAA. We've also talked with a number of institutions within medicine who are members of institutions that have a medical school too. Excuse me. At our school, all of the work that we do for the athletics is volunteer. And so I am not on a salary in the athletic department or the medical school. We're doing this because it's a project that we are very interested in. When I retired from clinical medicine, this is now my focus and my feature. And I'm still learning from everybody that I see. And I hope I can share some of the things I've learned, with them. So first of all, you have to find somebody who's willing to spend, a significant amount of time, because the more you do it, the more adept you get at it, and the more you understand how you can help people individually. So, we hope to be able to spread this word around. We have written up one of the projects that we're doing with this student athletes in medical school as mentors. And we're planning to submit that to an educational journal to help people get interested in that. And then hopefully at medical meetings, now that we have a lot of information behind us and thousands of hours of working with people, that maybe we can interest other people in doing it at their institution, and realizing how valuable it can be for your own interest, for your own career. Emil, it's inspiring, and we all want to do something that makes us feel good at the end of the day, and for me, it's inspiring. Just working with people and watching their journey, watching the passion that they put into it. It's hard not to really get involved in that when you see how involved, they are. And so, that's the goal now, is first of all, to spread the work we're doing within the entire athletic department. And when you've got an athletic department this big, some kids don't even hear about it. So we have to put it in all the newsletters. We have to put signs up in the student lounges, and eventually we get help. But the vast majority of new people that we get in come from referrals from other members of their team who have already been in it, So it's not an easy process to start. And it was much smaller when we started than it is now. And each year we find new ways to improve it. One of the things we're working on now is to develop a group of students that we hope we can send on a visiting tour to a pharmaceutical company or to a large healthcare institution or National Institutes of Health, or one of those things, so they can see, where medicine is going. And of course, that has to be paid for by someone. So, we're going to have to get donors, to put that process. But we fortunately, in our athletic department, in what's called the Michigan Athletic Career Center, we have a director who's very helpful about this sort of thing, very knowledgeable about how to get donors involved, and is very supportive of everything we want to do. And that's what it takes. The athletic director has got other things on their mind,
Yes.
Overseeing big budgets and all of that stuff, hiring coaches and all. But you need to identify someone in the department, in the athletic department, who will take an interest in people who have this particular goal. And so, we have this Doctor is In program that we call it, but there's also a program for prospective law students, for prospective business students, which came as a spinoff of this medical one. And we find now that all of these are so fascinating and so helpful to all of us.
So one of the other questions I know I wanted you to give some insight in is certainly since the pandemic, since obviously that's been such a
Yep.
remarkable sea change. I want to kind of get a sense from you about how you feel students are similar or how they've changed or are different. And certainly in college athletics, that whole landscape is totally different. I mean, again, this is the 2024. I mean, thank goodness you guys had, Michigan got their national championship, but now all of a sudden the Big Ten has exploded. And all of the other issues as you hear regarding athletics and sort of student athletes' rights and so forth. I want to get a sense from you. What do you see from working with the students that you have? Has there been any changes in terms of how they are prepared or how they reach out or engage with people who are advisors or experts in this area?
Well, again, that's an excellent question, and there has been a sea change without question. First and foremost is the whole idea of how we interview. Prior to the pandemic, everyone had to come to the medical school and see what it was like, walk the floors, meet additional people, see where students live, medical students live, see where they go for breakfast, see where they go to hang out for off time and free time. Now it's all have to be done online. And so the admissions office makes sure that during the week of the interview that they have the opportunity to meet students, groups of students, so they can ask questions one-on-one, with other students and get sort of the inside story. And then they will also invite people who have been given an acceptance to come back for a second look. And essentially it's going to be a first look because they might not have been there before. Right. But the good thing about all this is that, let's say you live in California or Florida and you want to come to the University of Michigan to be interviewed. That's an expense. And it's going to take 2 or 3 days at least, out of whatever you're doing. And then you got to find a place to live, which the medical school will help you with. But still, it's a major expense. And if you have 3, 4, 5 interviews and they're scattered around the country, medical school applications, medical school itself is expensive. But to add this to it, it's very, very challenging. So the pandemic in many ways has made it easier for us and easier for students. And we've seen since the pandemic, larger numbers of people applying because now they can apply from their home and they can interview in the comfort of their home or comfort of a room in the institution, that they're coming from. So that's good. But also the pandemic caused some serious medical problems with many people, with many families. Lots of premature deaths, lots of changes in behaviors, lots of just almost across the spectrum changes. And as a result, young people growing up, going through high school, getting into college, now became interested, having watched their mother or their father or a relative, a grandparent, become, seriously ill, and watching how hard it has been to get people cared for during times of crisis, and watching how complicated some of the medical procedures are and some of the treatments are. And they'll say, I saw how the doctor for my grandmother or for my father really helped him or her through this process. And I felt, gee, what a great field this must be. And I think I'd like to do that, So it's interested many people in healthcare, at least to investigate it. Now, going to our program, out of all the people that show up as pre-med students, and this is true of every university pre-med program, not all of them wind up being physicians.
Right.
Some of them, when they realize what the road is like, how many years it's going to take to get where they're going, some of them will go off into other fields. So maybe, that might be nursing, or maybe it might be physician assistants, less number of years of study. But some of them just say, I met a lot of patients, it's not for me. I just don't feel like personality-wise, this is where I can learn. And so, it all depends. It's a journey.
So I'm not sure if you have children who are also in the medical field. So this will be kind of tied into that.
Okay.
if for anybody who has children in high school age who are trying to pick a school, a university, college, or whatever to attend, and they are interested in a health professional field, probably most likely medicine, but it could be a lot of others. What sort of things do you suggest parents and their children should be looking for if they want to find an environment that continues to nurture and support them in that pursuit?
Well, to answer your first question is I have a son and a daughter, and they are both physicians. And they both live in Ann Arbor.
Okay.
My daughter is a radiologist, and my son is a pathologist. And so, of course, we spend a lot of time in Ann Arbor with our programs, but I have the side benefit of seeing my family and our 4 grandchildren who are between the ages of 13 and 15.
Oh, wonderful.
We did not stress to our kids the importance of going into medicine. What we stressed instead was investigate all the possible opportunities that you have as a career and find something that interests you and give your whole to it, get passionate about it, and really investigate it. If you think medicine is going to be for you and you know what a medical family is like because you've lived with one, rest assured it's not going to be the same everywhere. So make sure that you have opportunities to shadow other people who are not your parents, and find out what their practice is like. If your father is a radiologist, shadow with an internist or a primary care physician or a surgeon or something. If your father's a surgeon, then shadow with somebody else. And for physicians whose kids may be interested, just share with them how wonderful a field it is in your judgment, how you got through the challenges, and let them know that there are issues that have to be dealt with. There are responsibilities that you have. There's dedication, if I can use that word, to the career. There's a discipline that you have to have within yourself in order to put up with all of the economic challenges, all of the disability challenges, all of the disadvantaged challenges in your community. If you're going to be working in a suburban area or a rural area, or even in the city, a lot of times people will approach you as physicians to get involved and to become an advocate for their programs. And, almost every physician I know is an advocate for something, that relates to their field or maybe a related field. So, realize that when you get into medicine, these are all disciplines that you're going to have to pay attention to and have to be a part of your life. It won't be easy. It won't be free of challenges, but rest assured it will be rewarding, without any question.
So I'll try and wrap up with maybe 1 or 2 more questions. So,
Sure.
So one of the questions I have is, obviously you've retired. Are you still teaching over at or what is your responsibility at that teaching hospital?
Yeah.
Close to New Hampshire, where you are?
My responsibility is entirely related to the mentoring.
Okay.
And so I do not do any teaching there. And I spend 100% of the time that I give to medicine within this field. And so I did a lot of teaching when I was younger. And that was part of my profession. But, it's whatever you do, if you find the right thing to do, you have to give yourself time to really get acclimated to it and the discipline to stay with it. If you do it very part-time, it's tough to do. But I think anyone who wants to get involved in that, talking to a local medical school, talking to a local athletic department, talking about a program like this that you might have heard from, or you can, I'd be happy to talk to anyone, about the challenges of going into doing something like this. But the rewards of doing it outweigh it as far as I'm concerned.
Sure.
I'm at an advanced age now that one of the things that's on my mind when I see these students is I want to make sure that they're the kind of people I can go to for help when I need it. So I'm a little selfish in that regard.
No, that's definitely a common theme among all the people I've trained as interviewers. But in terms of who are you mentoring out there, are you mentoring medical students from UMass or any others that are rotating, and also
No,
residents and fellows there? Or is it who are you mentoring out there?
no, I mean, there's occasional people that we meet through families and all that that
Okay,
aren't a part of the program. And I do some work for one of the organizations that helps students prepare for medical school, Kaplan. So I do some work for them as well.
sure.
And so
Okay,
I see a group of people that are not related to what I do at Michigan.
okay.
And that
Any
program is entirely separate from the university.
Okay. I just want to get a sense of any sort of final thoughts in terms of, what sort of ways to encourage, students throughout this process, because it's 15 months long or even longer for people who have to reapply or whatever. Just basically any sort of words of encouragement for anybody who's going to just dive headlong into applying for medical school or any of the other health professions programs that, we definitely still need people for.
Yeah. First of all, it's competitive, and therefore it's academically competitive. And so when you're thinking about this as a career, you need to make sure that you give as much attention as you can to your academics so that your GPA reflects that you're a good student. You need to follow up and do some things related to clinical investigation, scientific investigation, or I can use the word curiosity. You don't have to be in research to get into medicine, but you want to at least have an experience with it to know what it's like. Then you need to read the newspapers. You need to read the magazines and the journals and find out what are the healthcare problems that are important in the United States. And, if you're in college right now, you've got a great advantage because we're only 3 years past the pandemic, which has taught us, all of us in medicine and all of us in society, a great deal of how to deal with rapidly spreading medical illness, with rapidly spreading medical illnesses and large numbers of people, setting of priorities, all the things that require marshaling health resources to deal with serious community things. And if that doesn't fascinate you, then maybe medicine is not for you. But that's what I would do, and read about it and see where your interest lies. Do some shadowing, talk to professors, find out what medical institutions are interested in certain things. And so that's, basically, what you have to realize, that you need the discipline, you need responsibility, you need to be aware, and you need to really want to do this. And the way you find yourself wanting to do it is to get interested in the things that have really caused us problems over the last few years.
I appreciate it, Dr. Wasco. Thank you so much for this conversation. It's probably close to an hour, but I hope anyone who winds up viewing this conversation on YouTube or wherever, really appreciates all the wisdom that you've imparted to everybody. So thank you so much for all that you've done to impact the lives of so many people, and obviously the profession as well.
Well, right back at you. I mean, the Student Doctor Network is incredibly valuable, in terms of helping people through this navigated process. And you all, at your institution and your program are just, giving your all to help people through this process. And I'm delighted that you're there. I'm happy to be able to, share some of what I do with you. And I'd be happy to, help out, in any way that, you might want, if I have the time to do so. So I'm grateful that we had the opportunity to share this.
Well, thank you very much, and I appreciate it. I hope you have a good rest of your day. I'm going to stop the recording.
Okay.